I think we're all a bit in that same predicament of not knowing what might happen. But I think we've talked today about the fact that you can't just blow up something and then someday park something back in. It's too disruptive. So it'll be incremental, whatever happens. And you know, my faith is in the ability to work out some changes in healthcare delivery that are meaningful and long-term and improve the quality for everybody. That's the only logical course of action that I can see. Because we can't, as a country, just continue to let healthcare inflate at 7, 8, 9, 10% per year forever. I remember in the 70s when, you know, Ted Kennedy and the first national health insurance debate started, and we were all wringing our hands because, you know, this was going to happen and the insurance industry was going to disappear. It was, and I think at that time the gross national product percentage that went to healthcare was something like 7 or 8%, and we said, oh, that's just not sustainable. And here we are at, what, 17, 18%, and I don't think we've hit the limit yet. Healthcare is the most important thing to any of us in this room, and I don't think there's a budget that we would put on it. And so I think we are not, as a country, we're not quite there yet, but we're getting closer. The pressures are there, and the health systems are tired of being blamed for it. And I think that's why you're seeing these executives actually now saying, no, we're going to go down another path. We've got to be part of the solution. We just can't sit here and take a beating as being the reason that we've made no progress in healthcare transformation. So I actually feel fairly optimistic. Some people say I'm crazy, but I'm actually optimistic that we're ready to start making some significant changes.